Good morning, good afternoon, good evening, everyone, wherever you're calling from. My name is Sarah Onyango, and I'm a Senior Technical Advisor for Self-Care at PSI, and also the Project Director for the Self-Care Trailblazers Group, the SCTG. I also co-lead the Evidence and Learning Working Group. I'd like to really warmly welcome you to this webinar on behalf of the Self-Care Trailblazers Group. This is an important webinar for us. We'll be launching our first State of Self-Care report. This report captures our progress to date in advancing self-care and some of the opportunities we have moving the self-care agenda forward. We have a really packed agenda, which I'll go to shortly. But before we look at the agenda, I'd just like to share some administrative issues. First, as you'll note, we are recording the meeting, so that assumes your consent. We will be sharing the recording of the meeting at the end. Secondly, I'd like to encourage you to use the chat to introduce yourself. Please share your name, what organization you represent, and where you're calling us from today. And then finally, I'd like to encourage you to ask questions throughout the webinar. We'd like you to use the Q&A platform. So go in there and ask your questions. We might not be able to answer the questions orally during the meeting because of time constraints, but we are encouraging our presenters to answer all your questions during the meeting. Any questions that are unanswered, we will follow up with you. Next slide, please. As I have stated, we have a packed agenda and an exciting one, I believe. We will be starting off shortly with opening remarks, and we are privileged and grateful to have Dr. Samukheliso Dube to give those remarks, which I'll hand over to her shortly. This will be followed by a guided tour of the report, sharing highlights from the report by Martha Brady. Martha is the lead consultant that facilitated the development of this report. We will then move to the most exciting part of this webinar, which is the Contributors Corner. We are grateful to have 6 contributors with us today, and they will be sharing with us some of the highlights in the areas that they contributed to in the report. Following that, we will have Dr. Dinesh Kumar serve as a discussant. He will just share some highlights and key takeaway points from those presentations. And then we will conclude with what's next and how you can engage with us, engage in the report, or even engage with the SCTG. And that session will be led by Kim Whipke. And we hope to close the meeting at the top of the hour, after hopefully an exciting session. So now allow me to, next slide please, to introduce Dr. Dube. Dr. Dube is the Executive Director of FP 2030 and has more than 20 years experience in healthcare, including senior roles in the delivery and financing of healthcare. She leads FP 2030's Global Support Network as a central platform for FP that provides space for stakeholders to convene, to align, to share knowledge, broker resources, and advance the field. Before joining FP 2030, she worked with Afrocentric Health as a general manager and Royal Philips as a medical counsel for Africa and business development manager for Southern Africa. She has a degree in medicine and surgery from University of Zimbabwe, a master's in public health, a diploma in tropical medicine and infectious diseases, and a master's in business administration and finance and investments. And so we're really, really privileged to have Dr. Dube give remarks today. And just to let you know that she is actually headed to the airport. So we really appreciate her taking the time to do this. So over to you, Dr. Dube.
Thank you so much, Sarah, and good morning, good evening, good afternoon, everybody who is on this call today. Just saying thank you to everyone who has made this report to be possible. And in particular, we interacted with you, Martha, Sarah, leading this particular agenda has not necessarily been an easy feat. Just greetings from Pakistan, where today I had the privilege of seeing, some of the frontline healthcare workers who are even trailblazing from the front lines to ensure that self-care remains a priority. So I saw DMP see the groups that are leading that implementation in Pakistan, and it's just a privilege to see the work that you are doing here being implemented at a country level. So my name is Dr. Samgeli Sodube. I'm the Executive Director for FP 2030. I am pleased today to announce the release of this State of Self-Care report. It is a tremendous thank you from my heart to the Trailblazers Group and the many individuals who are working across the globe to make this report a reality. Now, one of the things that is important is people have always wondered, what is this self-care? Ladies and gentlemen, self-care is not new. It has been practiced since time immemorial around sexual and reproductive health. Using a condom is self-care. So is taking a home pregnancy test. So is tracking your menstrual cycle or searching online for information on family planning, particularly for those with inadequate access to formal healthcare services. For example, I know displaced populations, I was seeing them here in Pakistan, people with disabilities, adolescent girls and young women, many others are, self-care interventions for them can be life-changing. So this work would have a multiplier effect. It's a critical component of achieving Sustainable Development Goal number 3, and which is about good health and well-being for all. Colleagues, you recall that several years ago, the WHO issued guidelines that set out important recommendations for self-care in family planning and fertility management, for antenatal and for postpartum and medical abortion care, self-testing for sexually transmitted infections and sexual health. Now, these guidelines, what I've seen is that in 2022, they've been expanded into a broader set of living guidelines. They include, but they are not limited to SRH interventions. We saw them in HIV. This has situated self-care as a core strategy for advancing a wide range of primary healthcare goals. And for me, what I'm seeing is that this effort has actually enabled many to integrate self-care into everything that is community health and in primary healthcare. Now, there is practical evidence from self-care interventions that is emerging from across the globe. These experiences should play a role in global efforts in achieving universal health coverage. When it comes to family planning, which is my passion, which is what I wake up to do every day, we know the most effective system is one that covers the broadest range of contraceptive choices, including self-care options. By preventing unintended pregnancies, colleagues, by expanding access to family planning services, you tend to lower healthcare costs by enabling and advancing self-care options, which can allow national health systems to provide more care to more people. It is incredible what we have seen happening when a country ensures voluntary, modern, rights-based family planning methods are advanced for its people. Improved access to family planning sets countries on a stronger development path for gender equality, for economic development, and for many sustainable development goals. Now, in our global community, this report offers essential lessons and insights into how self-care interventions can help advance rights-based, equitable access to SRH for all. I'm glad I could be part of this important journey. Thank you very much, ladies and gentlemen. And thank you so much, Sarah, Martha, and everyone for inviting me here today. Thank you.
Thank you very much, Dr. Dube, for those remarks, really setting the groundwork for this webinar. We appreciate your contribution, and we look forward to your support in continuing to disseminate this report. I'd like to move on to our next presenter. Our next presenter is Martha Brady. Martha, as I mentioned, was the lead consultant for the development of this report. She works as a women's health and self-care consultant and has lots of experience in SRHR. Feel free to read more details about Martha in the agenda and the bios that we shared. So Martha will be taking us through the report and sharing some of the highlights. Over to you, Martha.
Thank you very much, Sarah. And thank you, Samu. Excellent overview and good luck getting to the airport on time. We're with you. Godspeed. Welcome again. I'd like to join Sarah in welcoming everyone and thanking you for your participation and your willingness to be here. So think of this, I'm going to just do a really brief highlight. This is, as hopefully many of you have at least taken a look, it's about a 50-page report. So I'm going to give you the cheat notes, the cliff notes, and direct you to how you can use the report and what to look for. And when you read the report, think of this as like the smorgasbord. You're coming to a smorgasbord of ideas that are rich and interesting, and so you can pick and look through them. So with that, I'll give you some highlights. So next slide, please. So just a quick, the why, what, who, and how about this report. The why of why we did this now, right? There's lots of stuff on self-care. And as we know that there's really this momentum building, and we felt it important to capture the insights and consolidate that learning into one place. Many of the tools you've seen elsewhere, but having it in one place, I think, is very helpful. So that was one point. And then as Samu had mentioned, we now have evidence is emerging in a variety of countries and places. And so we thought it was important to pull them together where we could. And then finally, linking the self-care more strategically to UHC, I think, is very timely. So what do we hope this report to do? It really provides a snapshot of effective SRH interventions in a variety of settings. And we tried to take stock of country and global efforts and offer insights about how this could advance the SRH agenda. And most particularly, we see this as a rich resource. It's a compilation of experiences, references. We've done extensive references in this report, links to frameworks and evidence. So it's really a rich document. And then the who is it for? We hope that it'll be useful for a variety of different audiences to use as a resource, basically. So that's the why, the what, and the who. Next slide, please. Now to the how. Always challenging the how. We basically went through a collective group determining the thematic areas, did a literature and sort of documents review that include both peer review and gray literature, a scanning of kind of self-care tools and websites and various resources. And then we solicited case studies and program examples from a wide net of SCTG members across the globe. And we had, importantly, extensive communication with all the report contributors. And just to give you a sense, there's probably more than 50 individuals and organizations who have authored pieces or contributed in some way to this report. And that's one of the things we wanted to do, was to really get a collective group involved in this, which makes it a management challenge, but it was a fun one. And then we set up actually a sub-working group committee review to review the process. So next slide, please, just to give you, here are the report leads, and this is our working group for this report. I won't go through everyone's name here, but many of them you know and have joined us today. So that was the how of this report. Okay, next slide. So then I'll just direct you, again, I always find it I remember when we were in college and you just didn't have time to read the whole book, so you wanted like little cliff notes about where you should go. So we have 4 main report chapters, the first being the self-care basics that focus on terminology and frameworks. This is very rich with references, and I would really recommend you take a look at that when you can, if you haven't already. Section 2 is probably the largest bulk of the report, and that is where we have examples of where self-care policy, practice, sort of the enabling environment, and different program strategies meet. And that's where we have a lot of different examples and case studies in that section. Section 3, we have a section on measurement and monitoring. Again, as you may know, that there's an entire evidence learning and working group that focus specifically on measurement issues, of which myself and a number of us are on that group as well. So it's not, we've linked to that work, but we've just highlighted a bit in section 3. Section 4 is where sort of ideas and suggestions for looking ahead and what, areas that still need work, and how you might engage. And then again, big references and bibliography. So those are the main chapters. So next slide, please. When we looked for the case examples, we sort of had lots of discussion around that, and we wanted case examples drawn from a variety of settings and geographies, including fragile contexts, and include the following intervention tools. So DMPA-SC, the contraceptive self-injection, self-managed medication, abortion, HIV self-testing. We looked at self-administration of emergency contraception pills and ultimately pericoital pills, digital health as well. And then, so those are the content, the technology areas we focused. And then cross-cutting with that was looking at demand generation, the role of advocacy, and kind of guidelines development, country level guidelines. So those were the sort of main areas. Next slide, please. I hope I'm not talking too fast, but I'm mindful of time. So just again, I think you've probably seen all of these in different places. These are the main self-care frameworks that have been developed by a variety of organizations and the SCTG as well. They're in the document. We give a brief summary about it and then link to those references. Just again, to have it all in one place. I won't go into any of these. I think you're familiar, or you can read on that. Yeah, it's in chapter 1. Okay. Next slide, please. All right, so this is the challenge, so much to say in so little time. So trying to tease out just a kind of key messages. There are many, and I'll just give you a few here. First, that self-care is reshaping both how healthcare is delivered and the ways in which individuals seek care. So both of those, the supply and demand of that is actually changing at the moment. And we know that self-care is a long-standing and universal practice, but it's not formally been integrated into health systems in many settings. That's increasing now, happily, but it's not yet fully, I would integrate it into a lot of different health settings. As we mentioned before, it can, Dr. Dubé mentioned this, it really can contribute to UHC by making the health system more equitable. And importantly, I think self-care is the foundation really of primary health care. And so that's an important point. Another really important message coming from this, and it found its way in different pieces, is that the global and country advocacy plays an absolutely critical role in both socializing concepts of self-care and helping to create and shape that enabling policy and legal environment. And then the development of a multi-sectoral, the national self-care networks to advance self-care is considered promising, or I would say almost a best practice approach. Wanted to have a separate slide on that, but in the interest of time, didn't. But I really want to shout out these national self-care networks and the role of for example, in Senegal, the Pioneers Group, and in Nigeria, in many places, that function I think is really important, and is I think it's actually been relatively new in the field of introducing new technologies and products and things. So that's a really important one to watch. Next slide, please. Obviously, moving the country-led self-care agenda requires leadership at ministry and all the engagement of the right stakeholders at the right place and the right time, working together. We know that, and we're going to hear a bit about this later, that there's a critical role for self-care in humanitarian and climate and other crisis emergencies, but have not been fully realized yet. But that's a work in progress, and we'll hear a bit about that later. We all, I think, recognize the power of digital technology to support self-care is essential and is embedded into many of the activities. And then finally, importantly, continued investment is needed to ensure that self-care interventions, including health literacy, importantly, are included into, are appropriately supported. Okay, so. All right, so finally, I'll end here with some areas. Again, there's much more to say, but you'll hear next from our group, areas for continued action. I think the documenting of effective approaches of moving from pilot to scale in tandem with evidence generation. That is a work in progress. I think we've heard a lot of in the streamlining, the monitoring, evaluation, research, and learning. There's many different tools, and so streamlining the MERL is important. I think generating evidence around both cost and cost effectiveness of specific interventions is underway, but probably more of that is needed. I would argue the importance of the understanding the behavioral dimensions of self-care is still a work in progress. As we know, defining financing strategies and ensuring sustainability remains important. And finally, I would just make a strong point about the continuing research, collaboration, and learning to move the field forward. I think my time is up here. Yes. So we're moving quickly here. I hope that's okay. And I know I'm a fast talker. I'm going to move to the next slide, and so that's the smorgasbord of ideas. Now we're going to have some actual appetizers, examples from specific areas. And we're delighted to have Dr. Prita Biswas, who's going to lead this session. Dr. Biswas is the Senior Technical Advisor for Contraception and Maternal and Child Health at Pathfinder. She's also a member of the SCTG, and she's been active in this field for a long time. She's going to facilitate the session, and then we're going to have Dr. Dinesh Kumar serve as discussant after the panelists. So I'll hand it to you, Dr. Preeta.
Thank you, Martha. I hope everyone is able to hear me clearly. So good morning and good evening again to everyone joining us today. And apologies, but I think I will turn off my video immediately because I'm having bandwidth issues. So as the first panelist, I'm very pleased to Uganda, and she's also a member of Uganda's self-care expert group, where she has been instrumental in piloting Uganda's national self-care guidance and also finalization of the country's guidelines for career. So the Uganda case study can be found in the report on pages 13 to 15 and provides an excellent example of how
It looks like we're having challenges with Dr. Preeta with her internet.
I can jump in here if we don't get Dr. Preeta back on.
Go right ahead.
Maybe we could switch to the next slide. So these will be the next three panelists, and you've already. Oh, are you back? Okay.
Yes, Dr. Lane, we just wanted to hear from you on how you succeeded in terms of, advocating for self-care. What were the arguments that were convincing in getting the ministry on board, and what challenges did you face, and what are your next steps in terms of moving forward? So, Dr. Lane.
Thank you very much, Dr. Preeta, for that introduction. And the question is clear. I'll start off by saying that right from the start, our government of Uganda, or should I say the ministry, recognized the catalytic role of self-care in advancing access to SRHR services, and also its contribution to achievement of universal health coverage. Amidst that recognition, government was grappling with a couple of issues. And specifically, these included integration, that is integrating self-care into a mixed health system that includes the public, the private, and even the community per se, and also the digital element. Another issue that the government was grappling with was supporting the health workforce to embrace self-care as it relates to its definition. Then also the issue was incorporation of self-care into the National Health Management Information System that already existed. Issues around ensuring commodity security, that is having the product, what does it mean to disposal, and also quality assurance. And then the literacy levels of the self-care that we're going to, that we are trying to engage and be better self-carers. And then another issue that we're grappling with about financing. So to try and answer or address the aforementioned concerns as at the time of drafting our national guidelines, our government determined that let's just implement these guidelines and explore acceptability and feasibility as well. And this process happened last year. And from that process, government or even its partners are learning and also invigorating their commitment to advancing the self-care agenda. And the learnings in there is that this cannot be done as an individual, as government standalone. So there's a multi-sector approach. Beyond Ministry of Health, the Ministry of Education, the Ministry of Local Government, there's ministries of related gender as an example, but then also the issue of multidimensional approach. So we're looking at the issues around equity and diversity. There are different people that are coming, even to different geographies within the same country. And then also partnerships in advancing the agenda. And so as government is embracing its responsibility of providing an enabling environment for self-care for all, these are the next steps that they're considering. They recognize that there's support from development partners. We know that CIF has been very instrumental. There's Hewlett, there's USAID as examples, but then also implementing partners and also government in itself, the parliamentarians who we would consider as the chief or the champions for this because they speak directly to the communities. So specific next steps include finalizing and having our national guideline for SRHR approved and thus implemented. So the finalization is also including development of the implementation plan, then would address the concerns that have raised earlier on. And then the issue of government is committed to securing legal policy, regulatory changes to advance a self-care agenda in the country. And you will learn over time that as we finalize our adolescent health policy, self-care is being incorporated. As we advance finalize our RAMNAC, which is the reproductive, maternal, newborn care and adolescent health policy, again, self-care is a critical issue that is being incorporated in there. So the other next step that government is looking at is that together with the communities, that is include the self-care themselves, we are coming together and designing approaches for mobilizing, addressing stigma, building champions, and also promoting access for self-care. And then finally, the issue of equity and diversity is a critical piece. What we talked about, the multidimensional commitment, where they're saying that we're leaving no one behind as we advance this agenda. Those are the critical next steps that government is having in place to ensure that the self-care agenda is advanced. Thank you very much.
Thank you, Dr. Lillian. This was really very useful, the insights that you've shared based on your experience. Our next panelist is Dr. Adewole Adefu. He's the country coordinator and technical advisor in JSI, Nigeria, and he has been supporting the DMPA-SC Access Collaborative work there. His work around demand generation for self-care in Nigeria, which is a very interesting sort of aspect of self-care, can be found on pages 15 to 16 of the report. So Dr. Adewole, we wanted to ask you to briefly touch on the rationale and the process for developing a demand generation strategy for self-care, and what influence has it had on self-care policy and practice in Nigeria? So over to you.
Yeah, thank you so much, Martha. For us in Nigeria, following the initial release of the consolidated guideline by WHO, the government of Nigeria was one of the first countries to start the process of developing our own recommendations. And I think from that experience was that collective thought about what are the next steps for us as a country. And I think one great thing the government did at that point in time was to move beyond waiting for things to follow the normal bureaucracy of government, but taking the quick critical step of beginning to unlock the bottlenecks that we see in full scale-up of self-care in Nigeria. I think one of those early learnings that we had was that we needed to bring the state along. And this is where actual implementation happens nationally. While the government is responsible for policy, actual implementation actually happens at the level of the states in Nigeria, which is subnational level. So there was that heavy presence in terms of collecting all partner inputs to ensure that we advocate to that level. But beyond that was the realization that self-care was new, it's an innovation. As an innovation in Nigeria, there was a need for us to begin to create demand around issues like health literacy, ensuring that women, men, and kids right holders have necessary information as to how to empower them themselves using self-care. So the critical thing that happened was the initial advocacy by partners to government. And we realized that for this to happen, in terms of SBCC, there was first the need for the reproductive health unit, which is the responsible unit for sexual reproductive health in Nigeria, to take that leadership. But there was that collaboration between them and the health promotion, which is actually responsible for championing issues around health promotion, preventive health in Nigeria. So that collaboration was healthy and was helpful to the quick takeoff in terms of convening partners. The process that went with that was to engage a consultant, was helping with that, and to move quickly to engage with stakeholders who are in social behavior change communication, pulling together all ideas that the country could use in terms of bringing to a start self-care in Nigeria. So I think there were about 2 convenings, major convenings, where we had those thoughts brought together. There was that collective agreement on what's the strategy going to look like. And from our perspective, the country agreed that we need to use the theory of change, of ecological, socio-ecological theory, to build that base in terms of looking at the stages of change that is necessary in self-care and adoption and maintenance in Nigeria. And that also dovetailed into an agreement as to what are the target audience in terms of demand generation for self-care in Nigeria. Of course, the primary audience were men, women, but majorly there was that thought about ensuring that we include adolescents and young people who are actually going to be major beneficiary for many of the products or portfolio of products that are in self-care. For the secondary audience, of course, there was that diverse thought about ensuring that we bring along groups like healthcare providers, partners, and spouses of people who will need these services, parents, peers, policymakers, traditional and religious leaders who are key to moving information in Nigeria. So that was the holistic thought about where do we want to see this go and who are the beneficiaries that want to target in terms of our social behavior change communication. The entire activity was channeled towards ensuring that as we scale up self-care in Nigeria, we have a collective thought about what are the strategies that I want to employ in actually bringing into this conversation all the necessary right holder groups that would need and benefit from that process. So for us, I think we are at the stage where we had that strategy launched by the Honorable Minister of Health sometime in the year. So we are at that phase where we are trying to disseminate that. JSI, John Snow Incorporated, World Health Organization, Pathfinder, Society for Family, Association for Reproductive and Family, and several other people who have participated in this process are also thinking through how do we ensure that we disseminate this strategy in such a way that we are able to ensure that at the point of implementation, that those who will use this strategy can actually benefit from it. And there has been an initial engagement with subnational level that was championed by the Access Collaborative Project. We brought together all the social behavior change communication officers and the other information officers at the state level to do a kind of orientation as to
Dr.
what are the
Adewale,
strategies.
if you could just be brief, please, so that we have time for the rest.
Okay,
Thank you
so much. I think basically that describes the process and what we are looking at in terms of moving it from a document to actual implementation. So we are looking at where we're going to go from beginning to implement that. Thank you so much, Martha.
Thank you, Dr. Adewale, for sharing your experiences with us. I will now move on to our third panelist, Andrea. So Andrea Edman is the SRHR Advocacy and Communication Specialist at IRC. She supports strategic advocacy related to SRHR, including the ongoing work IRC is doing at both national and global levels to scale up SRH self-care in humanitarian and fragile settings. IRC, in fact, has articulated key issues and challenges for self-care in these settings on pages 32 to 34 of this report. So Andrea, can you discuss the mechanisms that exist for self-care in humanitarian settings, such as the MISP, and what you see as the next steps and opportunities for advancing self-care in these settings moving forward?
Yes, thank you, Dr. Prita. And I'm honored to speak today on behalf of both the International Rescue Committee, but also the IWOG Self-Care Task Team, and everyone else who's focused in that group on expanding SRH self-care in humanitarian settings. So just to begin, this is kind of detailed in the report, but more than 80 million women and girls, adolescent girls, are in need of humanitarian assistance, and 450 million live in fragile settings. And on top of that, when you look at the 23 countries that are in the process of developing national self-care guidelines, nearly half of them rank within the top 20 most fragile states globally in the world, or host significantly large populations of refugees or internally displaced persons. So we're very focused on ensuring that the considerations of these populations are included when we talk about national self-care guidelines, when we talk about uptake and scale up of self-care. Obviously, we all know, and we've heard today from the panelists and from the report, that in these situations, self-care provides a critical opportunity to ensure that there's access to necessary sexual and reproductive health services. And it's increasingly becoming recognized for its potential to fill those gaps, especially in disrupted health systems, which we find in fragile settings. So about a year ago, the Interagency Working Group on Reproductive Health in Crises, which is also known as IWOG, IAWG, formed our IWOG Self-Care Task Team. It's currently made up of 22 organizations, which include national organizations, international organizations, research institutions, and donor representatives. And over the past year, we've come together as a community to identify the key gaps and enablers for sexual and reproductive health self-care in humanitarian and fragile settings, to share knowledge and best practices, and to identify key actions for progressing humanitarian considerations for self-care in these settings. And we're always open to new members if you're interested in joining, if you have a background in working in these settings, or if you represent a government or a organization that is in a country that has a fragile context. So some examples of our work thus far include creation of a tool that aligns self-care interventions with the minimum initial service package for SRHR in crisis situations. This document is also known as the MISS. If you've heard of it, it's kind of the go-to foundational standard for emergencies. It's designed to address priority reproductive needs in the initial days of an emergency. And there are actually many self-care interventions that we've heard about today that are in the report that align with and build off of the MISS. So we've created a useful tool that highlights those 6 MISS objectives, and then alongside it has a detailed list of the self-care interventions that can be initiated in an emergency situation. So we can also share that tool later. A few months ago, we also released a global assessment report entitled Self-Care for Sexual and Reproductive Health in Humanitarian and Fragile Settings, Barriers, Opportunities, and Lessons Learned. So looking particularly at the challenges and enablers in humanitarian and fragile settings for scaling up self-care. We thought we would find quite a lot of differences between stable settings and fragile settings, but it turns out there were not as many as we expected, and that it's more about working in partnership and coordination across the nexus when we're thinking about scaling up self-care. So building off that assessment, as well as a technical consultation that we held at ICFP back in November, and I know some people on this call were at that consultation, so thank you. We are now going to launch a global call to action that we've created in collaboration with the SCTG and also all of the members of our self-care task team, as well as representatives of governments that are currently scaling up national self-care guidelines. So that call to action is going to launch in 2 weeks. We can share more information about that event in the chat. But the call to action outlines 3 policy and practice shifts that sexual and reproductive health stakeholders can advance to accelerate self-care in humanitarian settings. The first is strengthening coordination and partnership across the nexus, humanitarian development nexus. The second is cultivating an enabling environment for research, innovation, and learning in humanitarian and fragile settings. And the third is increasing investment for SRH self-care, which Martha talked about earlier. Within each of these, there are actually specific 3-year targets that we as a global community want to meet. So some examples of those include, we want 50% of all countries in the world to include SRH self-care products and strategies into their disaster response and preparedness plans. So ideally, this means that when an emergency situation arises, that has already been built into the preparedness and resilience planning process. Another example
is a reminder to just keep the highlights, please, so that we are good with time. Thank you.
Sorry, I'm almost done. Thank you so much. And then another example is just that globally we want at least 10 research studies to be conducted to increase the evidence base for SRH self-care in humanitarian settings. So we'll share more information about that event. It's on July 26th. But just to say that advocating for self-care, as we know, can help strengthen health resiliency to cope with current and future emergencies. And we hope that SRH self-care services are prioritized as both an effective option to increase health coverage in humanitarian settings and also as an essential human right. Thank you.
Thank you, Andrea. Our next panelist today is Monica Mutesa from PATH. So Monica currently serves as the country coordinator for the DMPASC Access Collaborative project in Zambia, and she has successfully supported the introduction of DMPASC in both public and private sectors, including the introduction of self-injection. This exciting piece of work can be found in the report, and so also the development of a dashboard. And this can be found on pages 22 to 24 and then 39 to 41, just to so that you can signpost those pages. So Monica, there has been enormous progress in moving contraceptive self-injection forward, with increasing number of countries approving self-injection. So from the Access Collaborative experience, what have been the key factors that facilitate the approval and adoption of self-injections at the policy level and also at the end user level? And what do you see as the most important next steps for DMPA-SC self-injection efforts? So over to you.
Thank you very much for the introduction. Just as a background, the Path JSI Access Collaborative is a global initiative to increase access to DMPA-SC and self-injection as part of an expanded range of contraceptive methods through data-driven TA, coordination, resources, and tools. And to answer your question on the key factors around the policy level, the Access Collaborative conducted a self-injection policy landscape in the late 2022 and identified several policy enablers. Which enablers are most relevant depends on the country and context, but one key takeaway is to take action early in the introduction process, plan to implement policies at scale from the start. We have also had success mobilizing champions such as our self-injection ambassadors who can advocate for policy and solicit strategic support. This is evident in countries like Nigeria, Uganda, Zambia, etc. We have also had success, it's also important that we consider the full value proposition of DMPA-SC, including SI, early in the planning process. This can enable countries to maximize the reach of routine programming. And an example can be given in the case of Zambia, where when we were doing the roadmap or the national guidelines, we ensured that SI was included so that when we came to the point of implementation, we did not have to rework policy issues. At the level of the end user, which is the women, informed choice counseling is key. Providers should make sure women have full information about all methods, including self-injection, so that they can find a method that best suits them, which helps improve continuation. For clients who choose to try self-injection, providers need to take time to train and coach women on how to self-inject. This will help them set them up for successful self-injection and help save time in the long term. And also the quality provider training is important. This should be followed up with supportive supervision, as well as ensuring that the client experience is good. And this is very, very critical because it ensures that the program continues. I'm not sure whether I'm supposed to answer the important next steps for DMPA-SC and self-injection as well.
You can be brief, Monica, but try and keep to the question as far as possible. Thank you.
All right. So, the important next steps for DMPA-SC self-injection efforts, the deliberate and strategic engagement of the private sector is important, including pharmacies, drug shops, and private clinics. This helps to increase women's access to DMPA-SC. But more importantly, I want to speak to translating data into action. This is very, very key going forward because collecting this data will be important given that SI data may not be captured in the routine data. And advocacy on this has begun in several countries, but more needs to be done for those who do not have it in their HMIS to come on board. I think I'll end there. Thank you very much.
Thank you, Monica. We'll now move on to Lulu, who's our next panelist. She's from IBIS. And Lulu is supporting research on the use of telemedicine for abortion care delivery in the US, but also expanding access to self-managed abortion and medication abortion accompaniment globally. She also supports evaluation and research with the mobilizing activists around medical abortion, in short, the MAMA network across the African context. And this work can be found on pages 29 to 31 of the report. So Lulu, can you briefly talk about the origins and rationale for the medication abortion accompaniment model? And also moving forward, do you see any new challenges or opportunities arising?
Yeah, thank you so much. So I'll just start with a brief grounding in the history and origins of self-managed abortion and the medical accompaniment model. And so self-managed abortion is not new by any means. Women and pregnant people have been self-managing their abortions for thousands of years. And after the discovery of misoprostol as an abortifacient by pregnant people in Brazil in the 1980s, feminist organizations and collectives have and continue to facilitate support to abortion seekers outside of health facilities using misoprostol and mifepristone where it's available. And in Argentina, Nigeria, and more than 40 other countries, activists provide support to people seeking to end a pregnancy by providing on-demand care, information, and support grounded in a compassionate approach while actively working to counter stigma, violence, and judgment. And so they offer this support via phone, messaging, or in person. And they do so by providing information on how to safely use medications to end a pregnancy, information about possible warning signs, how to assess for completion, and strategies for safely interacting with the healthcare system in the event of needing or wanting medical care. And so this is what we mean when we talk about hotline or accompaniment models. And it's important to note that these activists are largely unpaid volunteers, and they are the reason we know what we know about the safety and effectiveness of this model. And it's really their work and their willingness and desire to partner with organizations like IBIS in research that have really gotten the World Health Organization to change their abortion care guidelines to include this model of care as a recommended model. I also want to identify how this model of self-care differs from other self-care models, in that the accompaniment model for self-managed medication abortion is really a model that was developed independent from the medical system, meaning it is a demedicalized model. And that's because of the restrictions and states' abdication of the responsibility to provide safe and legal abortion through their health systems in many contexts. And so that challenge of restriction and criminalization of abortion in these contexts really remains. And while this self-care model is highly effective and safe, as well as a preferred method of care for many people, it doesn't eradicate the legal need for legalized, non-criminalized abortion in these contexts and in the world. And in terms of opportunities, I will note that since writing this piece for the report, we have had the opportunity to continue partnering with medical accompaniment groups and abortion hotlines in Nigeria, Argentina, and Southeast Asia, where each of our partner organizations have worked to design and implement programs to expand access to their models of care. And for just a quick example, our partners in Argentina have developed a training program for medical students and teachers in comprehensive sexual and reproductive health, with a focus in self-managed medication abortion and expanding access to their accompaniment model. And so that's just one of many of the innovative and really amazing programs and interventions that our partners have developed that we're currently evaluating as a part of our SAFE 2.0 study, which is a follow-up on our studying accompaniment model feasibility and effectiveness study, whose findings were published in the Lancet in November last year.
Thank you, Lulu. This was really interesting, and thank you for sharing your experiences. Our last panelist for the day is Dr. Karen Hatskold, who is the Global Associate Director for HIV and also the Director United STAR Self-Testing Project at PSI. Dr. Hatskold supported the introduction and scale-up of self-testing for HIV, hepatitis C, and COVID-19 across 15 countries as part of the project. And the work related to HIV self-testing conducted by the STAR Consortium can be found on pages 27 to 28 of the report. So Dr. Karen, can you comment on how HIV self-testing can help strengthen health systems, and how the evidence from the HIV self-testing experience can be applied to other areas of self-care and self-testing?
Yeah, okay. Thank you so much for having the floor. And I would like to talk a little bit more about the evidence that we have created and achieved with the STAR project on self-testing. And that not only includes HIV self-testing, but also self-testing for other disease areas, including COVID-19 and hepatitis C, hopefully moving into other areas and other health areas for where self-testing might make a difference. So I would like to specifically speak about the potential to strengthen health systems, and I would like to look at this through a lens of potential impact on at primary healthcare level, the potential of self-testing for contributing to achieving universal health coverage, and its importance also in providing continuity of health services during pandemics, crisis, like this was the case during the COVID-19 pandemic, and also its use case in surveillance and pandemic preparedness, for example, with COVID-19 self-testing. So from the primary healthcare level, self-testing allows individuals to access testing services very easily. So it brings testing very close to communities, make it more convenient and also readily available, showing more equitable access, and that's really important for health services for all. We have shown this in the, at STAR with our use cases to increase accessibility can be particularly beneficial for individuals that face barriers to accessing traditional healthcare services, so that are facing barriers like geographical distances, transportation issues, stigma, and limited health resources. We have demonstrated this for specifically with key populations, for example, and also priority populations for specific for HIV testing, such as men and young people. We have tested different distribution models from community-based, community-led distribution through pharmacies, including online distribution, and also have adopted and optimized these distribution approaches to reach these priority populations. We have demonstrated that self-testing really facilitates early detection of HIV disease, which is really important. This is a self-diagnosis, and then enables individuals to seek timely treatment and care. So dependent on the population and geography, we found a high percentage of first-time testers. So self-testing provided really early access to diagnosis that would otherwise not have been identified. So the early intervention improves health outcomes, also reduces the burden on the health delivery system. Self-testing can also promote health literacy. We have demonstrated this through our research as well, empowering individuals to actively engage in their own health management. And it encourages individuals to take responsibility for their well-being and makes informed decisions about the healthcare, and therefore also reducing the burden on the health care providers. But self-testing also empowers individuals to proactively monitor their health status. Yeah, this is a diagnostic test and identifies risk factors for certain conditions and diseases. And in the document that we're just discussing, I speak specifically about the use case also for increasing access to PrEP, pre-exposure prophylaxis, and HIV prevention services. So for example, self-testing for HIV, also sexually transmitted infections, STIs, and certain cancers can help individuals assess their risk and take appropriate prevention measures, such as adopting behaviors, and as I said already, accessing PrEP, PEP, and HIV self-testing is a very important entry point for PrEP, pre-exposure prophylaxis, for those people who want to prevent HIV, especially amongst high-risk populations, and also helps monitor PrEP continuation. So self-testing can also optimize resource allocation for health delivery system, because we're shifting certain testing tasks from the health facilities to individuals, and free up time for healthcare professionals, especially in high burden countries where testing services are offered in public sector healthcare facilities as a routine testing measurements. We can actually use HIV self-testing, for example, as a screening tool. So the redistribution of responsibilities can enhance the efficiency and effectiveness of healthcare delivery. During pandemics and health crisis,
just a reminder to just summarize the highlights, please. Thank you.
Yeah, and self-testing can be important. I'm nearly done. To ensure the continuity of health services. So for example, during the pandemic or crisis when healthcare services may be disrupted, like during COVID-19, self-testing ensures the continuity of HIV testing and monitoring. And that was particularly important during COVID-19. So HIV self-testing ensured continuity of testing services and initiation of ART in this specific context. Minimizes obviously transmission risk if people don't have to go to the healthcare facilities to get access to testing services and test at home. It minimizes their risk of transmission of COVID-19. And last but not least, self-testing can play an important role in disease surveillance and monitoring. So we have demonstrated this with the research in our use cases of COVID-19 self-testing by collecting data on test results. Individuals can contribute to public health efforts, such as tracking disease prevalence and also identifying emerging outbreaks. Monitoring treatment effectiveness is also another aspect in terms of surveillance. And then aggregated data for self-testing can also provide a valuable insight to inform public health strategies and resource allocation. So all this contributes to health system strengthening. So in summary, HIV self-testing or self-testing holds a great potential in strengthening health systems by enhancing primary health care, expanding universal health coverage, ensuring the continuity of health services during pandemic crisis. And we believe it's a crucially important to integrate self-testing into healthcare policies, programs, and ensuring availability, accuracy, and supportive services. And embracing self-testing can lead to more comprehensive and sustainable approaches to prevention, treatment, care, and also improving overall health and benefits for communities. Thank you, I'm done.
Thank you.
Thank you, Dr. Karine. Thank you to all the other panelists. I now welcome Dr. Dinesh to take over and facilitate the conversation, summarize some of the discussions and also respond to some of the questions. So over to you, Dr. Dinesh.
Just before Dr. Dinesh, just to let you know that we're running a little late, we'll probably go 5 past the hour. So we just ask you to hold on so that you can hear the way forward. Yeah, Dr. Dinesh.
Yeah, thank you. So I think we'll take one question, and the question is that how is access collaborability approaching the lack of availability of DMP subcutaneous? So maybe Monica can answer the question.
Dr. Dinesh, we're answering the questions in the Q&A. We just wanted your summary of the discussions so far. So just some key highlights you've taken from the discussions is what we'd like to hear. The presenters are answering in the Q&A.
Thank you. So like the key point, and then to summarize that what is important to uptake the strategy of self-care is political commitment, preparedness of the system, and the evidence to convince the policymakers, and informed choice by creating the awareness in beneficiaries so that in demand can be increased. So there is a research gap which needs to be filled, and especially in terms of monitoring the self-care. So without wasting much of the time, I think we have spoken about the networks, the investment in financing, and the research uptake and its strategy as a future, as a way forward. So now I will introduce Kim, who is the Chief of Staff of White Ribbon Alliance. That is the largest grassroots level network for women's health, right, and well-being. And she's also co-chair of SCTG Country Advocacy Working Group. She's a passionate human rights advocate, having more than 15 years of experience in policy advocacy and communications. And she looks for implementation of global campaigns. So here, Dr. Kim, welcome. Please take the floor.
Great. Thank you so much, Dr. Kumar. I think in the interest of time, I will keep my remarks very brief and stick to 2 ways that you all can engage in some of these next steps. So next slide, please. I think first and foremost, we really encourage you to read this report, to let the information and insights sink in, to share it with your networks, and also to let us know how you're using it and how it's informing your work. We're really interested in that type of feedback. In addition to the ways that you can engage here, if you could go to the next slide, please, I'd like to highlight one key opportunity that's coming up in the following months. We've had a really vibrant discussion and sharing of insights here, and this is really just the tip of the iceberg. I'm happy to say that the White Ribbon Alliance, on behalf of the Self-Care Trailblazer Group and in partnership with many organizations who are even on this call today, we're bringing back the Self-Care Learning and Discovery Series. It will be a virtual mini conference that takes place over a 3-week period starting in late October and running through mid-November. We have an open call right now out to SCTG members and self-care stakeholders more widely to submit your ideas for abstracts and sessions that address key themes and hot topics in self-care. Whether you work on research or programming or advocacy, you know, we really welcome any and all experiences and insights. Proposals are open until July 30th, so you have to hurry up a little bit, but we have a couple weeks left for submission. Encourage you to check out the information about the series and the application form on the link provided here. I'll put it in the chat as well. But again, we hope to see many of you presenting and participating in that forum and also just attending the sessions in general. So with that, thank you very much, and I will pass it back to Sarah to close us out.
Thank you so much, Kim, for those points about how everyone can join us going forward. It's time up, and I just really want to take this opportunity to thank you all for an excellent webinar, for great engagement. We've seen many questions in the Q&A, and I hope the presenters are responding to those. Really grateful to Dr. Dube for being our key note speaker, so to speak, but also thankful to the contributors for the amazing work that you've shared. From the discussions, we can see that there's a lot of interest in these, in hearing what everyone is doing. So we look forward to continuing engagement with you, building towards the next report, but also in the upcoming Self-Care Learning and Discovery series. Don't hesitate to send any questions that you have to the Secretariat and all the members of the group. Thank you and have a good rest of your day. Bye.
Thank you.
Thank you.
Thank you, everyone.
Thank you. Thank you, everyone. Bye.